you've seen this new drug, Ozempic.
If you've been relying on Ozempic or Wegovy for significant results,
it was FDA approved to treat the conditions of overweight and obesity.
Mounjaro or Tirzepatide is the newest novel medication that has...
Ozempic, Wegovy, and Mounjaro are medications for treating type 2 diabetes, but they've gained attention recently due to the controversy around their use for weight loss among celebrities. Although healthcare providers generally accept their off-label use for weight loss in eligible individuals, though Wegovy is FDA approved specifically for weight loss, it's crucial to understand the distinctions among these medications, their mechanisms, and their current approved uses. Here's what you should know about Ozempic and Wegovy. Ozempic and Wegovy share the same active ingredient, semaglutide, which falls within the glucagon-like peptide-1 or GLP-1 receptor agonist medication class. They target type 2 diabetes and obesity, respectively. Wegovy contains a higher concentration of semaglutide with 0.5, 1.0, 1.7, or 2.4 milligrams weekly, compared to Ozempic with 0.5, 1.0, or 2.0 milligrams weekly. Ozempic is approved by the FDA for diabetes, while Wegovy has FDA approval for weight management. GLP-1 is a hormone that promotes insulin secretion after carbohydrate consumption. Insulin helps cells absorb glucose from the blood, but in type 2 diabetes, this process is impaired, raising blood sugar levels. GLP-1 receptor agonist drugs delay stomach emptying and inhibit glucagon production, stimulating cells to absorb glucose and thereby reducing blood sugar. Additionally, these medications boost glucose absorption in muscles, reduce glucose production in the liver, promote satiety, potentially curbing appetite and leading to weight loss. It can also reduce stroke, heart attack, and mortality risks in adults prone to heart disease. Research shows that semaglutide may lower these risks and improve functional status in heart failure patients by reducing key contributing factors like high blood sugar and excess weight. Now for the things you should take note about Mounjaro. Mounjaro, featuring the active ingredient tirzepatide, is FDA approved for type 2 diabetes, but is often used off-label for obesity. Eli Lilly, its manufacturer, reports that tirzepatide can lead to a 22.5% weight loss and anticipates FDA approval as an anti-obesity medication this year. Tirzepatide is a dual GLP-1 and glucose-dependent insulinotropic polypeptide or GIP receptor agonist. GIP, an intestinal hormone, triggers insulin secretion and improves insulin sensitivity. By targeting both GLP-1 and GIP receptors, tirzepatide offers compounded benefits over GLP-1 drugs like semaglutide. But now let's take a closer look at the individual differences of each medication. Let's start with Ozempic. Ozempic is a prescription medication used in conjunction with diet and exercise to manage type 2 diabetes. Developed by Novo Nordisk, it helps regulate blood sugar levels and lowers the risk of cardiovascular events, such as heart attack and stroke. However, it's important to note that Ozempic is not a treatment for type 1 diabetes and is not an insulin product. FDA approvals for Ozempic. In the US, the FDA has approved Ozempic for treating type 2 diabetes and for reducing the risk of serious cardiovascular events like heart attack or stroke in patients with both type 2 diabetes and cardiovascular disease. Ozempic may also be used off-label for weight loss in overweight individuals to improve health outcomes like high blood pressure, which is more prevalent in this group. While Ozempic is not directly intended for weight loss, it has been used for those who need to lose weight, manage their diabetes, and reduce their risk of cardiovascular complications like heart attack or stroke. Off-label use of Ozempic. One concern around Ozempic is its liberal prescription for weight loss, as it isn't FDA approved specifically for obesity or weight loss. Therefore, there are no official guidelines for its use in weight loss. Experts recommend that appropriate candidates meet criteria similar to those for other weight control medications, or insufficient weight loss after 6 months of lifestyle modifications and a BMI of 30 or above, or a BMI of 27 to 29.9 with a weight-related health condition like diabetes, prediabetes, or hypertension. So how do you take Ozempic? Ozempic is administered via injection. Ozempic uses a standard insulin pen device. It can be injected into the abdomen, thigh, or upper arm. Ozempic's manufacturer advises not to inject it into a muscle or vein and warns against combining it with insulin in the same injection. Injection sites should be rotated with every dose. Dosage is personalized to each patient. For those using Ozempic to manage type 2 diabetes and reduce the risk of heart attack or stroke, the initial dose is 0.25 milligrams weekly for 4 weeks, then increased to 0.5 milligrams. Healthcare professionals may adjust dosages as necessary, but patients should consult them before making changes. Side effects of Ozempic. Ozempic can cause nausea, vomiting, and diarrhea. Take note that if you're not eating as much and are feeling nauseous, vomiting, and experiencing diarrhea, dehydration becomes a risk. Constipation is also possible since Ozempic slows digestion, causing food to remain longer in the stomach. Severe but uncommon side effects include thyroid tumors, seen only in animal studies, studies, alongside gallbladder and kidney issues. The label lists significant risks, like pancreatitis, that may alarm people. Recent data, however, suggests pancreatitis risk is minimal, and we don't believe thyroid cancer risk extends beyond rodents. Those with eating disorders could see worsened symptoms since the drug suppresses appetite and results in weight loss. There is risk to exacerbate an eating disorder by adding this medication without addressing underlying mental health issues. Ozempic face. Some patients using diabetes drugs have reported facial sagging and aging due to rapid weight loss, resulting in reduced facial fat. Experts clarify that weight loss of any kind can affect facial appearance. It's purely cosmetic and not pathological, but it concerns some patients. Now let's talk about Wegovy. Ozempic and Wegovy both contain semaglutide and operate similarly, though Wegovy offers a higher maximum dose. Though they're the same medication, they have different brand names and slightly distinct dosing schedules. Both are manufactured by Novo Nordisk. Their key difference lies in their FDA approvals. What is Wegovy approved for? While Ozempic is FDA approved for diabetes, Wegovy is fully approved for weight loss. As of June 2021, Wegovy is approved for chronic weight management in patients with a body mass index (BMI) of 27 kilograms per meters squared or greater, with at least one weight-related condition like high blood pressure, type 2 diabetes, or high cholesterol, and a body mass index of 30 kilograms per meters squared or greater. How does Wegovy work? Wegovy, like Ozempic, is a GLP-1 receptor agonist, helping regulate blood sugar while maintaining satiety between meals, supporting weight loss. The drug also suppresses the liver from producing excessive sugar. These drugs regulate the speed at which food passes through the digestive system. They slow things down. Food remains longer in the stomach, creating a lasting feeling of fullness. How do you take Wegovy? Similar to Ozempic, Wegovy is administered via injection. However, instead of an insulin-type device, it uses an EpiPen-like mechanism. Wegovy is injected weekly under the skin in the upper arms, abdomen, or thighs. The manufacturer recommends starting with a weekly dose of 0.25 milligrams for 4 weeks, gradually increasing to 2.4 milligrams. Since 2005, we've progressed in using these medications to treat diabetes. From twice-daily injections to once-daily products, we're now primarily using weekly self-injections. Side effects of Wegovy. Common gastrointestinal side effects may include nausea, as food remains longer in the stomach. Wegovy shares the same side effect risks as Ozempic, including constipation, upset stomach, diarrhea, and vomiting, making consultation with healthcare providers vital. Taking these drugs without medical supervision could lead to these side effects. Additionally, they haven't been studied in pregnancy, posing potential risks to developing fetuses. Wegovy's manufacturer lists severe side effects like pancreatitis, gallbladder, and kidney issues, while warning of possible thyroid tumors and cancers. Now let's explore Mounjaro. Manufactured by Eli Lilly, Mounjaro manages type 2 diabetes alongside diet and exercise. While similar to Ozempic and Wegovy, Mounjaro targets 2 hormones that regulate blood sugar levels and aid weight loss: GLP-1 and glucose-dependent insulinotropic polypeptide. Mounjaro is a recent addition and is in the same category as Ozempic and Wegovy, but with an extra compound to amplify the effects. What is Mounjaro approved for? Approved in May 2022 by the FDA to treat type 2 diabetes, Mounjaro may be used off-label for obesity and is on the fast track for weight loss approval. How does Mounjaro work? Like other type 2 diabetes medications, Mounjaro reduces blood sugar, improves insulin sensitivity, slows digestion, and suppresses appetite, leading to weight loss. Because Mounjaro targets 2 key metabolic hormones, patients may experience more substantial weight loss. More significant weight loss with Mounjaro's dual incretin was observed compared to the single incretin medications, which was suspected due to the combined effects of 2 incretins. How do you take Mounjaro? Mounjaro is a weekly injection, which can be combined with insulin, but should not be mixed in the same syringe. Patients typically start with a weekly dose of 2.5 milligrams, injected under the skin of the abdomen, thighs, or the back of the upper arm. Side effects of Mounjaro. Common side effects include nausea, diarrhea, reduced appetite, vomiting, constipation, indigestion, and stomach pain. More serious side effects, though rare, include pancreatitis, low blood sugar, kidney failure, allergic reactions, and gallbladder issues. Mounjaro's manufacturer warns that it may cause thyroid tumors. Patients with a family history of medullary thyroid carcinoma should avoid this medication. Obesity is a chronic condition like high blood pressure, and these medications offer long-term management. These are incredible drugs that can transform lives for those who've tried diets and exercise. But powerful drugs come with powerful side effects. Consulting a knowledgeable physician ensures the risks and benefits are appropriately managed. Now that you're familiar with these 3 medications, keep in mind that even with various weight loss drugs available, diet and exercise remain essential in overcoming obesity. All those drugs, while offering a percentage of weight loss, should be combined combined with lifestyle changes, experts emphasize. It's crucial to prioritize healthy eating, not only focusing on a calorie-restricted diet to lose weight, but also ensuring the quality of your food choices. If you want to see more health, nutrition, and lifestyle tips, please subscribe to my channel and turn on notifications with the bell icon. Stay healthy and happy.